hall meeting for the Waianae Coast. I'm Senator Maile Shimabukuro, representing the district that spans from Kaena Point to Kalailoa. And we have a very robust agenda tonight. So without further ado, I'll pass the mic now to Representative Cedric Gates, who's also going to introduce us tonight.
Hello, everyone. Thank you all for joining us today. We wanted to really provide an opportunity for residents to get accurate, up-to-date information on this COVID-19 pandemic. I want to thank everyone for the many sacrifices that you guys have been making to ensure the safety and well-being of our Hawaii. And without further ado, we're going to introduce our hosts and our guests. So from the executive branch, we have Lieutenant Governor Josh Green. From Mayor Caldwell's office, we have Josh Stanbro.
Aloha. We
have Senator Maile Shimabukuro, myself, Representative Cedric Gates, Councilwoman Kimberly Pine.
Aloha.
Thank you. We have Richard Bettini and Nick Huey from Waianae Coast Comprehensive Health Center. We have Sergeant Mike Kahikina from the Honolulu Police Department.
Aloha.
We have Tom McDonald from Kahumana Farms. We have Joseph Lapalio from Waianae Economic Development Council.
Aloha, everyone.
We have Cynthia Resentis from the Nanakuli Neighborhood Board. And Chair Shar Poi has sent her regrets for not being able to attend this meeting today.
Yeah, she's not feeling.
Did I miss anyone, Maile?
Let's see, we got Ma'o. You said
Ma'o, correct.
Ma'o Kahumana.
Yeah, Ma'o. So we have Sharice from Ma'o, correct?
Yes.
Yes.
Yeah, Kaui.
Hey, Sharice.
What's up?
Kaui, how's it going?
Good.
All right.
And then
So
Kahumana
that
is
is
Tom.
all our guests that we have today to present to the community. And first off, we're going to start off with Lieutenant Governor Josh Green for executive branch update from the governor's office.
Hey, okay, well, so great to see everybody, and thank you guys for all being such heartfelt, excellent leaders. This is a time that we've never seen before. The sacrifices are incredible that people are making, and I'm going to dive right in. It's paying off. So as of today, 4 new cases, all right? Four new cases, which is amazing. We're at a total right now, 584 cases. 2 cases on Maui, 2 cases on Big Island yesterday, 0 cases on Oahu, Molokai, Lanai, Kauai, incredible. So the sacrifice that people have been making is working by staying home, home isolation, social distancing, wearing, sexy masks, there you go, and everything possible to keep people alive. The key here, and I'll put my physician hat on, is for every 100 people or so that end up testing positive, we end up with an individual in the intensive care unit on a ventilator. So ventilators, mortality rate's about 50% once you're on a ventilator. So it's very, very risky once you've gotten that sick. So here's the ventilator number, all right? So you see this, we are only using 15% of our ventilators in the state. That's 68 out of 459 that are active. We have 535 ventilators actually in the state, but we don't have them all fully activated right now because they do a lot of maintenance and they don't have to have them all up and running at all times. And we've also been seeing some success. The state of Hawaii, we've had 10 fatalities, as you're aware. The latest one was an individual who traveled from Washington State. So, our heart breaks anytime anyone dies from any of these kind of outbreaks because they're all unnecessary in a way. It comes out of nowhere. But our mortality rate is the second lowest in the country. Our rate is 0.7% of those who contract COVID-19 end up dying. The rates are as high as 6 or 8% in some other states. And the lowest in the whole country is Wyoming, which is 0.3%. But they have so few cases that it's just a different story. It's kind of apples to oranges. But we are very well prepared medically to take care of people. People often ask me how many tests we've done. Well, I believe we're ranked 3rd in the country as far as tests per capita. Here are our numbers, all right, guys? So 24,543 people have been tested. That means a 2.37% positive rate when you look at the numbers. A few more tests have been done because some people have had to have multiple tests. I was just on the phone with the wife of a gentleman who had to have 2 tests. He had cardiothoracic surgery and was quite sick and is in the intensive care unit. He didn't end up having COVID-19, but he had bypass surgery. So these are the realities of COVID-19, but the way to beat it is obviously stay isolated. We right now have had 423 out of 584 people who've tested positive recover. That's a 72.4% recovery rate. And others are in the process of recovering. They just haven't gone through the 2 weeks of full recovery. So I've been getting briefings from our team, and the most interesting probably piece of information that's come to light is the way we've modeled. And when we modeled what would happen if we neglected to stop travel into the state of Hawaii, which would have meant a lot of positive cases, or had we allowed for kind of unfettered transmission, we would have had a catastrophic situation with well over 100,000 cases, and this would have been our death total, 4,479, as of the peak, which would have occurred on April 17th. So good on you guys for completely committing in a tough situation, because we know people have had to set their employment aside and set a lot of their economic priorities aside. And what you've done is you've saved 4,479 of your fellow Hawaii Ohana. It's just that simple. Would the number have been 6,000 or 4,000? It's hard to say. Probably would have been much higher, because when you have a surge like that going with a very high peak and then fall from an infection like this, it would have disrupted all the other healthcare that we're capable of doing, such as diabetes care or ventilator care, or people being placed and getting their dialysis. So devastating losses if you don't listen, and people did. So we've bent the curve. It's very flat. If you look at our curve now, we had 6 cases, and then we had a little tiny surge of, I believe, 21 because the McDonald's blew up on the Big Island, which was a bummer, and then back down to, a very small number once again, which is refreshing, and that should give us hope that we are doing well. Now, to move on from some of the health stuff, because I know people will ask me about those issues, and I'm happy to talk about them. It's the easiest thing for me to talk about. Obviously, there's some economic problems. We've got as much as 37% unemployment. Now, that's going to be extremely temporary once tourism begins again, and tourism will begin again. There is going to be an incredible pent-up demand for people to come to Hawaii. Having said that, we're going to have limited immunity throughout this season, and the immunization is going to take some time to come. It always takes at least 9 months, and usually 18 months for a vaccination. So we're going to have to be very careful, and I would expect that a proper recommendation is going to be to make sure people get tests within 72 hours of their travel to Hawaii. That's about the only way we can guarantee, or with high certainty, that people aren't traveling here as asymptomatic carriers of COVID-19, which, if you can imagine what we normally experience, we normally have 700,000 people a month traveling to Hawaii. Imagine if we even just had 100,000 individuals, but 3% of them, 3% were positive for COVID-19. That would be 2,100 individuals walking around that were infectious. And we only have 584 cases right now that we've confirmed. So we will have to take great precautions, and we're working on that plan. But when I speak about unemployment, we still have to get the economy going. So we have a recovery team that's been put into place. Alan Oshima, a very well-respected leader and a terrific human being, is going to be leading the charge for the governor. So we're putting this huge, incredible investment of health and safety in place, but we also have to reopen. So that's going to come. Do expect that there will be only modest reopening in May. I'll leave it to the governor to give some more of those details, but I think it's going to be a slightly slow opening, only because everyone is very concerned about having a secondary peak or spike if you were to suddenly flood the market with travelers. So be mindful that we're going to be cautious. I know that that's frustrating. I know there were even some protesters, and that's fine. I'm a protester at heart, but in this particular case, we can't allow ourselves to infect our kupuna. So we're just going to have to be careful. DLIR is working around the clock to address this huge influx of claims, over 200,000 claims, it appears, for unemployment. So they issued already 11.2 million in payouts last week, up from 4.1 million the 2 prior weeks before. A call center, as you know, has opened up. People can go to hawaiiworks.org, which is particularly decent, hawaiiworks.org. But I know people have gotten stuck on the website. So there's a lot of frustration, except now we're going to have hundreds and hundreds of additional people uploading people into their unemployment capacity. And then hopefully come midsummer, when the weather changes, which will have a positive impact, in other words, kill a lot of the virus, and we slowly bring tourism back, hopefully we'll get people back to work. Just as fast as unemployment went up, it should also come down with a pretty steep decline. It won't go back to nothing, because we're not going to go back straight to 700,000 people a month, but we will decrease unemployment very significantly. And obviously we'll open up the rest of our economy. For instance, on May 1st, even actually now, but more formally May 1st, we'll start doing additional healthcare procedures and return to some of our regular emergency department schedules and our operating room schedules, allowing ourselves to do some of the surgeries that had been delayed. So some of the elective surgeries, we have enough PPE now to do that, the personal protective equipment, and that will help us with what we just need for our own health and for some of the economy. You'll also start seeing some more of the basic economy returning as we get comfortable with very, very low virus loads in our state. We'll gradually get to a place where people will open up parks again, and we'll open up restaurants slowly and so on. I do think it's going to take a couple months before we feel comfortable with a significant number of travelers. And I'm working hard on some of these tests, like the antibody tests, which are not yet ready for prime time, to give us that option. They're very quick. They only take 90 seconds to run, but they're not quite there yet. So we've had multiple emergency proclamations. Gov has done 5 of them. One, for instance, includes an eviction moratorium. So that will help people. But then there's the homeowners themselves, and they need to pay their mortgages. So we'll be working on that as well. Department of Hawaiian Homelands has deferred mortgage payments for a period of 6 months for beneficiaries with direct loans and loans assigned to DHHL, effective with the April 2020 payment. The CARES Act has relief for homeowners and government guaranteed mortgages. So people need to reach out to their mortgage lender. And again, I was on the phone trying to get my AAA insurance done today. I mean, it took me forever. So I'm totally sympathetic. Everything's taking a ton of time. So just be patient and stay at home, and we'll be okay. We've done some successful things, and a terrific thanks go out to Mayor Caldwell and his team for the Ka'ahi Street Center. That's a center that Mayor turned a building over in partnership with the folks that do harm reduction. My old nonprofit H4 is contributing some medical staff, and just there's a lot of good work going on over there in Iwilei to help with the homeless circumstance. We are asking for extra support for Kauhale and Waimanalo and Kona, and a tiny Kauhale started yesterday, 32 tiny houses in Hilo. So people are stepping up. I think Josh will probably talk about the post tent on Oahu. That's very valuable. That was a $6 million appropriation from the state to the county to work on home relocation and permanent housing, but obviously being purposed for the challenges that we got with COVID right now. So there's lots of important work being done there. The state parks and beaches are certainly an interesting point of contention. Right now, people are debating whether or not we should be able to go out and exercise on the beaches and in parks. I'm going to tell you straight up, I think we should be able to, as long as we socially distance. Being outdoors in the heat is actually less risky than being in line in grocery stores. So that's probably going to come to pass over time, but I understand that the mayors have to demonstrate their prerogative. I respect that. Each of them feel slightly differently. I speak to them with some regularity. So that's another big issue. Of course, go out and swim and surf as much as you want. There's no way you're catching COVID from a shark or an eel. So you're going to be in good shape there. Do be safe though. The other regular parts of life are still out there. You probably need to have someone else watching over you, because we still have drownings, and we're going to have less capacity with lifeguards and other things when they deal with other issues. So all of these things should be taken in context of regular life. The Department of Education, I should touch on that. They're using alternative measures for commencement ceremonies. I may very well propose, if we have the capacity, some gift to graduating seniors, perhaps some support for community college next year. I think that might be the right thing to do after we kind of took their senior year away from them for the right reasons, but it's difficult. I can remember how important that was to me, and I have a 13-year-old now, and I wouldn't want to deprive her of that experience. So we'll be working on that. There will be distance learning through May 28th, which is the last day of the school year, and rollout of summer school is going to be tenuous at best. It's too soon to determine what next year's school year will look like, but I have a feeling that we will get the schools open in the fall. I think that is going to be something to debate, but we'll be looking at the trends of the disease. And in general, these trends are favorable when you look at coronaviruses come summertime. So I'm gonna pause there. The couple of ways you can connect with me, if it's helpful at all, do social media, which is at @LTGovJoshGreen, at @LTGovJoshGreen. Call me on my cell phone, which is 937-0991, 937-0991. I'll probably give you Mayor Caldwell's phone number later just to torture him. I think, guys, just make sure that you're staying safe, everyone, through the end of the month. I do think that there's very interesting pressure out there. The most important thing is to have our ducks in a row when we reopen. So if I may stop there, you guys, it's your call, but I'm getting close to 15 minutes, and I want to be very respectful of all of you and all of your contributions to this talk.
Thank you, Lieutenant Governor. Appreciate you being here with us, and we'll have you on for questions after the Mayor's office, Josh Stambro, presents. Awesome. Okay, Josh, the floor is yours. Josh Stambro.
Great. Thanks, Representative Gates. So aloha, everybody. Thanks for having me and having Mayor's office speak to the community. I'm actually the Mayor's rep to Nanakuli Neighborhood Board. I've missed the last couple months getting out there, seeing the community. And I know Char's not on, but we had to cancel a climate change open house that we had planned with her. And so we haven't been able to have as much touch with the Waianae side as I'm used to. And I just want to express to everybody how we know how hard this has been. I mean, especially for everybody holding things together at home. I've got a 9 and 11-year-old stuck at home, out of school, bouncing off the walls, and just appreciate my wife being able to do the homeschooling. And I know that that's the case all over the island right now, where folks are in a totally different new paradigm. And it's hard. People are struggling, obviously with the unemployment rates that Lieutenant Governor spoke about. But the other side of this is that we're an island community, super resilient, and I've just been so impressed by seeing how folks have pulled together and surviving this, adapting to it. And I think, like Lieutenant Governor said, we're going to come out the other side thriving, and probably more so than other communities that haven't been able to pull together so tightly, so quickly. Today, I think we should, as hard as things are, we should celebrate the fact this was the first day in over a month that Oahu didn't have a new positive test emerge. It was 0 today for Oahu. So, I think all of the hard work and some of the difficult orders, some of the leadership that all 4 county mayors and the governor have led with has been difficult, but there's results. We saw 109 visitors still come into the state today. That's another place we got to do more about, is making sure that we know exactly who's coming in, because we saw the numbers of cases falling as that traveler count obviously was reduced. And so we got to make sure that, we're taking care of the job here internally. One of the things that Mayor did right away was ask us to set up a call center. He thought it was really important to have somebody live to talk to, for folks to get information and to be able to reach out and catch a live voice. So Lieutenant Governor said he'd give the mayor's number out to drive him crazy, but I'll give the number out for our call center that'll drive all our staff crazy here. But that's what they're there for, is 768-CITY. If you've got any questions at all about, the different stay-at-home, work-at-home orders, what's an essential business, are parks open, are they not, what can you do, what can't you do? We've got folks that are there to answer those questions, even if it's just somebody you want to talk to. I mean, I know it's hard for a lot of our folks in the community, especially Kupuna, who might be isolated during this time. If they just want to reach out and talk to somebody, there's someone there. And actually the office that I work for, the Office of Climate Change, Sustainability and Resiliency, we worked with a couple other departments to set it up in a day, the call center, and then our staff from the Resilience Office staffed the call center. But now what we've been able to do once we started it up is bring back the few non-essential workers for the city that had job classifications that would have had them out of work and at home. We're bringing them back in, and they're staffing the call center now. So we've been able to really minimize the number of folks at the city that are not here working or working telework and trying to make sure the essential services that the city provides keep going. I've got a bunch of information I can share in the Q&A, but obviously the big ones are today, the mandatory non-medical grade face covering order went into effect. So that just means if you're going out in public, wear one of these, make sure you got one. This is one of the custom ones my kids made, but there's a bunch of different types. I got my fashion colors on. But if you're going out to the store, you're going on public transit, if you're going at all, if you're exercising, you don't need to have them. Obviously, if you're a child under 5, please, use your better judgment. Any kid under 2 for sure do not wear a face mask, and probably under 5 is good, because what ends up happening is they just wind up touching their face more because they don't like it on their face, and that defeats the purpose. The other thing is just to remember, everybody, that the social distancing guidelines are in place no matter where you are. So 6 feet of distance between folks, and the only time you can have 2 or more people together is if you're a family. I mean, really, those are the rules. It doesn't matter if you're at home at private, if you're out in public. Those are really the rules that we got to stick by. The more we stick by those tough rules, the faster we're going to be able to come out of this in a permanent, slow, gradual opening. So that call center that I mentioned, we've handled 6,479 calls so far. We're committed to keeping that open until April. That's the main pipeline of information for the city. We know that there's been a lot of confusion out there. Sometimes it's due to actual differences between the orders at the state level and at the city level. We've been working behind the scenes with the Attorney General's office to try to smooth those out and make it as consistent as possible. Sometimes it's inaccurate media reporting, or us not doing a good job of communicating. But things are moving really fast. So it's genuinely hard to keep up with what's open, what isn't. So the one place where you can go all the time to get the most accurate information about what's happening, both on the ground, a lot of the data that Lieutenant Green, Lieutenant Governor cited around how many cases there are, how many people are coming in, travelers, how many essential city workers, it's all on a dashboard that's publicly available. You can go to One Oahu, that's spelled out O-N-E, oahu.org, and all the mayor's orders are there. There's a dashboard there you can click on to get all the information that you want. And we pledge, if you can't find the information you're looking for there, then you can please call the call center. So we've had 88,000 people go to the website, and people have been turning to it on a regular basis. So the other thing that's on that dashboard is the city testing. The city has done a ton of work trying to help support testing. We actually are one of the highest per capita testing jurisdictions in the entire country. And I think, we can get more strategic about that. We can roll out more, but we should be really proud of the amount that we've been able to put out there. I know we did testing with Premier Medical Group. We did it at Waianae Harbor on April 9th. We had a bunch of our staff from our office out there directing traffic, helping out. Cocoa Head Park was this morning. And we only had 47 people show up for that test. So what we're seeing, I think, is we're seeing less people presenting symptoms because our numbers are going down. And so less people are showing up for testing. That's a great sign, but it means that we really have to be vigilant about keeping the genie in the bottle so that we can slowly reopen and maintain the numbers. We have been enforcing as well. You've probably seen HPD out there trying to enforce on the emergency orders. We've had 2,853 citations that have been issued to folks. You know, they'll continue to give warnings to folks. Usually they're not just citing just a cite. Usually it's something else that's happening that they're talking to somebody about, and then they wind up, you know, either getting pushed back or whatever, and wind up going ahead and citing. We've been putting city dollars to work, and in anticipation of the CARES funding coming, we have worked with partners to serve over 69,000 meals, over 2,500 emergency bags to nearly 7,000 kupuna in the community that we're really concerned about that, you know, may not have the means right now. We've got the Farm to Car Local Ag Initiative really trying to help support. I see Sharice on here from Ma'o Farm, which is great to see, and I know Kaumana is on later. If there's anything we can do to try to keep our farms cranking, we know the restaurant demand is down, and we want to get that healthy local produce into people's homes right now. We've been doing it with the Farm to Car initiative, but if there's anything else we can do, please reach out, let us know. Lieutenant Green mentioned the POST program. You know, there was a whole new program, which was really the way that we were going to try to move homeless folks into services, wraparound services. The HONU program has been halted for right now, given the crisis at hand. And POST is really it's a location at Kehi Lagoon where we're able to intake homeless members of the community, houseless members that may have be concerned about symptoms, make sure that there's social distancing there, and take care of them there. So the final thing I want to touch on, because I don't want to take too much time, is, you know, on May 22nd, Mayor Caldwell issued the stay-at-home, work-at-home order. I know it was, you know, a little bit controversial at the time, and I know Governor followed up a couple of days later with a similar order. The key here is that it has worked. If you look at that sort of estimated 2-week incubation period for COVID, and you look at where the onset of symptoms are happening on our dashboard on the website, this information coming out of Department of Health, almost exactly after the stay-at-home, work-at-home order, 2 weeks to the day, you get the major flattening out of the curve that we've seen over the past week or so. So it works, it's tough, but the more we stick to it, the sooner we'll be able to sort of unravel and begin to slowly open up. I think Lieutenant Governor is right around the parks issue, around people being able to get outside, and we're in active discussions around that. And you know, the key is the water. The ocean heals if you can. You are always allowed to cross a park, cross a beach area to get in the water, to go and to exercise, to swim and get in the water. So I know there's confusion about that, but the ocean is open for business. So if there's any other items, I'm happy to answer questions. We're working really hard over here, everybody in the city. I know folks at the state as well, just trying to do everything we can to protect the community. We also know that we're gonna make some mistakes, that we're gonna try some things that don't work. This is an unprecedented situation. There's no handbook for this. So we're trying to do different things and see what sticks. And so let us know what you think is working. And if you have good ideas, call the city hotline and report them. They'll make their way through to folks. Okay, mahalo.
Okay, thank you so much, Josh, both Josh Green and Josh Stanbro. Thank you guys for your presentation from the executive branch. Right now, we're gonna open it up for 30 minutes of Q&A. And again, thank you guys for being here and making time. So Kier?
Sorry, everyone can, so if you have a question, you can go ahead and unmute yourself. So we ask that once you unmute yourself, state your name and then ask your question. And as soon as you're finished speaking, can you remute yourself so that we can cancel out any unnecessary background noise. Mahalo.
Hi, I'm Sergeant Michael Kahikina from the Kapolei Police Station. I'm the supervisor for our community police team. And I have a question for Mr. Stanbro.
Yeah.
Mr. Stanbro, there is so much confusion with regards to our enforcement with the state of emergency proclamation from the mayor's office. Our confusion is a lot of the people they're not listening. One, we do understand that the water is open and they need to access that from the beaches that are closed. But what we're doing along the coastline from Ewa Beach all the way to Makaha is, being that the beach parks are closed, where initially when all of this stuff started back in March, we were warning the people that, you guys cannot park your vehicles in the park, the perimeter of the park, and whatnot. So the first couple of days, we've been actually trying to just warn them, if they violate the proclamation, because of the 127A-25, what we've been doing is we've been citing the vehicles, and we've been telling the people that have been going to the beach is somebody needs to drop you guys off. You guys cannot park your vehicles in the park. You guys cannot park your cars on the perimeter of the park, because that's all city and county. We've also been explaining to them that you cannot be on the sand, you cannot be socializing, you cannot be sunbathing. If you do, you're gonna get cited.
Yeah.
And we've given, just our district alone, within I would say maybe the last week of March up until now, we've given over 1,000 citations. And we still get a lot of confusion from the mayor's office as well as the governor's office as far as what can and cannot do. So I just wanted to let you know that this is what we're doing. And so from the mayor's office, have we been getting it right?
Yeah, I think, so as I understand the way that you guys have been enforcing what you just described, that is right. And I think what's important is there had to be a bright line rule out of the gate to make sure that everybody took the stay at home, work at home order seriously.
Right.
And what that meant was the parking lots at the parks are closed. You cannot be in the parks. You can traverse the park. You can walk through the park to get to the ocean, because the ocean, up until a couple of days ago, was open, right? So below the high wash of the waves, right? Below the high wash of the waves was state land. All beaches are state land. And so that was open. And so we weren't going to stop people from crossing a park to get to that beach. Now, with the order a couple of days ago, last week from governor, that the state beaches are now closed.
Right.
That's changed a little bit. So now, as we understand it, and we're getting clarification from Attorney General's office, it's wet sand is okay. So if you're on wet sand or your feet are wet, you're okay. But if now you cannot be from the high wash of the waves down to wherever the tide might be. I know this is really tough. And HPD has been doing an amazing job trying to enforce what are oftentimes evolving, quick decisions have to be made kind of rules. But what you described to me is how we understood it from the Corporation Council. That was the interpretation of that original stay-at-home, work-at-home order.
Right, because they're the people that's going to the beach now. They're playing this game, right? So as soon as we arrive on the beach, they see us coming. They all stand up from the sand and they go into the water.
Yeah.
So it's difficult for us to actually cite these individuals once they get into the water. So that's why we've been citing their vehicles. And as long as the vehicles are on city and county property, whether it's in the park on the exterior of the park, because we've actually tried to put up our yellow HPD caution tape, and we've been putting the tape at the entrances to block off anybody from going inside. So what's been happening is we have a lot of our community members, they're actually either ripping the tape down, or they're trying to park on the perimeter of the park, which is still illegal because that's part of the city. And they've been going into the water, whether they want to surf, whether they want to fish, whether they want to exercise and whatnot. And we get that.
Yeah.
But what we've been telling them is your vehicles cannot be parked here. So if you want to go and do all of this surfing and fishing and whatnot, somebody needs to drop you off. And so that's the stance that we've been taking. And we've been citing and we've been towing vehicles just so that they can get the message across, for us, get the message across to them that if you guys are gonna come to the beach, then you need to follow the rules. And
Yeah.
so I just wanted to make sure that what we were doing in our district was correct.
Yeah, and that was the message. We've been in communication with Chief Ballard, with Deputy Chief McCarthy, all through this, and it sounds like the message is getting through because you guys are actually doing the design that the Corporation Council put out, and that's why I want to mahalo, Councilmember Pine and Representative Gates and Senator Shimabukuro and everybody who put this together, because this kind of town hall to explain this is what the rules actually are. It's tough on HPD. They're trying to, navigate a brand new ordinance and law, but that if people understand the reason that it's there is to try to stop especially our vulnerable citizens in Kupuna from getting sick and dying. I mean, those numbers that Lieutenant Green offered up, 5,000 people wouldn't be here with us today, 4,600 people if we weren't making these hard choices. And part of that is dropping, yellow pieces of paper on cars to just let people know this is not the time to be hanging out together at the beach. This is the time for being at home, exercising, or bouncing out. So yeah.
Thank you, Sergeant, and thank you, Josh. Could we go on to the next question that we may have from the community?
Yeah, hi. Can you hear me okay? I'm Jared Thieler. I'm one of the, I'm actually a surgeon over at Queens Oahu West. And I got to say, some of the things just don't make any sense from a scientific standpoint. I mean, I think we need to be more like Sweden, where we need to let people do their thing and give them the social distancing guidelines and let them do it. I mean, Sweden has a similar spread, and their ratio is about 1,300 per million, which is actually less than ours in the US. And yet they've basically given it to their citizens to say, hey, you know what, socially distance it, as best you can. All groups over 50 stay closed, but restaurants are open, bars are open. All these local small businesses that are getting destroyed right now are all open. As a surgeon, I'm fine. Our family's okay financially. What I feel for is all these working class folks that now have these businesses or hourly wages that are getting destroyed, and who knows if they're going to come back in a couple more weeks. I mean, these things can't last for a few more months and expect some of these businesses to come back. It's just, and the problem is I know people think they're saving lives, but on the opposite end of that, there's a long trailing cost to this. And I know people want to talk about economics, but economics leads to healthcare problems. Economics leads to poverty, which leads to healthcare, which leads to death, which leads to suicide, all these other kind of back end costs that nobody seems to want to talk about. And I think we need to start thinking about there's not a null equation on the other side of these policies. The other side of these policies is massive unemployment. If you think we have a homeless problem right now, it's going to get way worse unless we start to figure out how to do this more intelligently and trust people to do the right thing. It makes no sense. For example, the beach thing makes no sense at all. Why are we funneling people into smaller areas? I mean, I get more exposed at Costco than I do at the beach if I'm socially distancing on the beach. I mean, I think it would make much more sense to give people basic guidelines, say, hey, socially distance, don't get me started on the masks, but whatever. But socially distance, wear a mask if you're going to be outside. But what is the purpose in saying you can't go to the parks, you can't be outside, when we know UV light actually is the best thing that's an antiviral? Fresh air and exercise are the two things that you can do probably better than anything else to prevent getting the infection or to basically strengthen your immune system. Vitamin D exposure, sunlight, all these things are really important. So why are we putting in these draconian measures that don't have basis in science?
Thank you very
That's
much.
what I got.
Go ahead. Who wants to take a crack at it?
I'll do it. So I appreciate it, Doc. I'm positioned also. So the policy decisions about parks are not good decisions. The policy decisions about beaches are not good decisions. They were populist, but not good decisions. And we should be allowing people to be in the parks and the beaches, provided they socially distance. The challenges that we have are very different than Sweden, unfortunately, because we are a tourist state. So had we allowed travel to come here, we would have had a deluge of people that don't necessarily listen to rules. That's one significant problem. And so we don't approximate Sweden as far as the orderly and the homogeneity, or the orderliness and the homogeneity of culture. These are cultural questions. It wouldn't work the same way here. We also do not have the healthcare capacity at all from an intensive care unit capacity that Sweden or other countries do. So that's another problem. So these are gigantic differences. Now, you're correct about the economics. I talk about that constantly, and that's why you're going to see a multi-trillion-dollar bailout from the federal government. And keep in mind, you're seeing all 50 states in a massive restriction of economy. Again, America is not Sweden, and America is not anything like that region. Unfortunately, perhaps, but we are our own culture. So those are some of the fundamentals. The mask rules, I agree with you. You know, obviously, the real need for masks is in times of extreme viral load exposure, which is procedures. And I understand also, of course, what it means to intubate an individual. So that's where the risks are largest. The big picture here is we were not willing to sacrifice the lives of 5,000 to 10,000 people. And we already have social structures in place, which include significant unemployment insurance, subsidies, loans, and ultimately a relatively socialized economy, which includes a very large portion of unionization and a very large elderly population that are already receiving social support through, Medicaid, Medicare, Social Security, that we are built for a response like this, but it's going to be painful. We need it to end in about 30 days as far as the lockdown goes, and then treat it like a 20 to 30% hit on the economy. That's the very best approach from my position. But no one is ignoring the realities of the economy, but we were not going to walk away from 5,000 lives, just so you know.
Thank you, Josh. Given the time constraints, we're going to move on to the next question from the community. Can you unmute your mic?
Yeah, I did. Thanks. Oh, wait, who's first? Can I go or? Okay, thank you. So, hey,
I appreciate it. Thank you.
Sorry, am I on or?
Go ahead, Philip. Yep.
Okay, thank you. So my concern is that RIMPAC is supposed to start in June, but we already have an influx of military personnel already going to start moving. So I'm still in the military as well, so I'm kind of been watching the movements. Everybody's kind of stalled in place, and they have the 14-day. But RIMPAC is supposed to come over to Oahu. Antibodies is one of the biggest questions that is still in check right now. They're doing it actively in San Diego for the reservists that has been activated in those areas as optional. Why are we not reaching out to the military? I see the National Guard being activated for different things, possibly for COVID, as well as the RIMPAC that's coming up. But why are we not enacting the military more often, or to be involved in this? Because they bring in a lot of stuff and they have the money. So we can drop a hospital in 72 hours in operating. So when I see everybody talking about, oh, this ICU is overpacked, we've dropped many of them in different states and they were never used. So, you know, it's the science behind it is kind of weird, but we are at a point where we need to say, hey, this is the timeline of our virus ends. This is the timeline that we need to lift the gates. And will it be because of RIMPAC, or is it because of the concern for the public? Thank you, that's all.
I don't know if Lieutenant Governor has a response, but I do know that the Army Corps of Engineers has been in discussion with the emergency operations centers for the counties in the event that additional hospitals, sort of temporary hospital space, needs to be stood up. Thankfully, because of the measures we've taken, we haven't had to expand, and the hospital capacity has been able to handle what we have. But I know those conversations have happened.
We have the capacity to stand up 300 bed unit. Cost is $140,000 per unit, just so you know, and we can do it very quickly if necessary. We've gamed it out. It takes 2 weeks to construct a significant facility. We also can drop in up to 150 emergency hospital beds at any time. We're fully prepared to do that. And the DMAT team should have been deployed to Maui and to Big Island for testing purposes, which I asked for about a month ago, but unfortunately bureaucracy got in the way of that. Cost us an extra 50 cases, probably 2 lives. So we're completely capable. Also, RIMPAC, if it occurs, is going to occur in a modified way. I'm not actually able to talk more about that right now, but I can tell you that if RIMPAC does occur, it'll be adjusted so that there will not be any direct injection of additional viral risk for the state.
We're going to move on to the next question, community.
Can I do?
Go ahead.
Can I have a question now? So, yeah, do I have to choose my camera, the video?
No.
Okay. Okay. My name is Melissa. I live in Anacoli, and I understand what we were talking before about the reinforcement of the beats, that we don't want the people spend the day and come and getting together on the beach and barbecuing. But I understand too that we live here, and for example, I cannot go access the beach close to my house because there is a lot of homeless people living. So today I went to walk in Pokai Bay, and the Pokai Bay, like, I have a sensation that all the homeless people from town and other parts from the island are coming here, because for 1 week from now, before, like 2 weeks ago, was clean, and now everybody's coming. So I don't understand why we're enforcing the people that want to go walk and the people want to go surf and swim, but we're not doing nothing about the homeless people that clearly is out coming to the west side right now. That's my question. Thank you.
I could take a quick shot at, I mean, I think the same critique around, you know, we had to draw some firm lines early on around the parks and making sure that people weren't gathering. I mean, the CDC was adjusting down numbers as fast as you know, you could turn around. It was, you know, 50, and then it was 25, and then it was 10. And I think it was around that time when it was shifting from 25 to 10 that the decision was made to close parks and make sure that people weren't gathering together, and sending a message that, you know, we really do want people to shelter at home. I think people have really risen to the occasion. They've, you know, for the most part, they have you know, answered the call and abided by the rules, and that's why we've seen the success we have. And you know, it is time to revisit and looking at how we can get people out and recreating again. That said, you know, the city has taken a pause during this time too, with enforcements around homelessness, and at the same time, we've been trying to expand shelter capacity at Waianae Civic Center and the villages at Maile. They've maximized their occupancy. They've tried to implement physical distancing where possible. You know, we have provided the quarantine isolation facilities for those that are unable to self-quarantine. That's the Ka'ahi facility, and the post facility. So we're also trying to, governor and mayor have, worked together and around ordering the suspension of lease terminations, evictions, foreclosures, because we don't want to add to the, the homelessness problem that we already have. And so I think we'll see a change in the very near future that'll help balance that equation that you mentioned.
Okay, we're gonna move on to the next question for the Lieutenant Governor or Josh Stambro from the Mayor's Office. Thank you, Melissa, for your question. And we'll be also having a Q&A at the very end as well. Go ahead, Michael.
Oh, my question, first of all, was to address the surfing. I get it, I understand.
Oh, we're having trouble hearing you.
Can you hear me now?
Yes, yes.
Okay, so the surfing part, I understand where people are coming from. I spent a majority of my life in the ocean, so I know definitely the healing powers it possesses. But I also, thinking about the whole time I spent in the ocean, thinking about the guys that kept me safe all those years. And, and talking with them throughout this pandemic time, it's kind of a stressful period for them. Seeing everybody going to the beach, not knowing who they're going to get possibly exposed to if they have to save somebody. And it goes for our firefighters and first responders as well, like on hikes and stuff. And so, just as adults, in times of when we are called upon, we should be able to show some restraint. It's just, to me, honestly, it sounds like a lot of me, But, people can sacrifice for a few months. I would imagine this thing going over much quicker. The other issue I had was to the mayor's office. On a regular basis, you'll have 68 officers down in Waianae. That's from Kapolei to Waianae. That's nearly not enough. Now they're being called upon to start, enforcing people on the beach and whatnot, and to try to take care of all the other issues going down in the neighborhood. 6 to 8 seems like a dangerous situation for both the public as well as the officers that have to man these areas. And because the lack of enforcement, manpower down there, people from all over the island, including tourists, they know, come down Westside because you'll have an easier time getting away with the enforcement in the lockdown period and stuff like that. So the Westside is seeing a lot of things going on, and there definitely needs to be some attention given, especially at a time like this.
Yeah, thanks. Thanks for the comment. I do think, being at the Nanakuli Neighborhood Board for the last few years, and, hearing, this is not something that just came up with COVID, as well as it's around making sure that there's enough officers on the west side. I know that the mayor has been worked with Chief Ballard and with Budget and Fiscal Services to provide enough funding to add a bunch of officers, I think up to 300 officers that would help fill those pukas. And it really has been a problem of recruiting has been difficult over a long period of time. I think that is going to change, honestly, with given the situation going on. So we're hoping to get more officers to be able to step up right now. And you're right. I really appreciate what you said about, the first responders, whether it's lifeguards, fire, police. These are the folks that, day in, day out are going out regardless of, exposure or whatever else, to sort of put their lives on the line to make sure that folks are in a difficult situation, that folks are trying to do what's right for the entire community and not being selfish. I think the great point you make is, if we're just patient for a little while and try to work this thing through and open up slowly, if we can open the faucet back up slowly and not have to clamp it back down, I mean, imagine what it's going to feel like as a community. We went through all this, and then if we misbehave and open it wide back up, and then we have to clamp it back down again, that's going to be twice as hard the second time. And so if we just hang in there, stay steady, do what we know is right by our neighbors and by each other, I think we can come out of it one time slow. And actually, I don't know, I'd be interested to hear what Lieutenant Governor Green thinks about this, because he's looking at all the other states and the situations. But because of our geographic isolation, I think we have a chance to do this better than anyone else in the country. And I think that's going to be a huge, kudos to our island population if we can pull this off.
I think
Okay.
let me add to that. So thank you, Josh. So yeah, the current plan is, if we continue to have, right now we have the second lowest mortality rate in the whole country, and the lowest rate per capita of COVID-19. So if we emerge from this, because unfortunately every single state is suffering global economic crisis. So when we emerge from this and we take into consideration Asia and Europe, all of whom are going to be dying to somehow put this crisis and catastrophe behind them, every single person on the planet that ever thought about coming to Hawaii is going to want to come here. So as we consider how we're going to emerge from this economic mess, we can imagine a great deal of resource coming to Hawaii. Now, it's going to be fraught with challenges, because if we immediately open up and don't have adequate precautions here, we will not, and we don't do it after the immunization or vaccination occurs, we could be in great peril. So we're going to have to be very careful, but there is a way to do it. I've outlined it for the governor and others. We can have people have a test before they come here and test negative within 72 hours of travel here, and that will keep our viral load very low. In addition to that, it will quickly ramp up people's desire to start their hotels and restaurants again, obviously. So all of those things are strong considerations for Hawaii, where we will, hate to make this about economics or competition, but we will outcompete others around the world if we've done a better job and haven't seen catastrophic outcomes. One thing that people have to remember, though, is though we are an extraordinary attraction for people to travel here, we are one of the smallest states, and our healthcare footprint is one of the smallest in the nation. So if we were to get the usual 7 million to 10 million tourists here, and there was a large crisis where we had a huge surge of COVID-19, it would be just bad for us. It'd be bad for the tourists. It'd be bad for everybody. I mean, it would be just devastating. So this is unlike anything we've seen before. This is a global pandemic. So it's going to warrant smart decisions. And if we make the smartest of decisions and keep ourselves extremely well equipped to screen people before they come to Hawaii, which is not uncommon. That's what people do with visas and other applications. They travel to Africa and they get immunizations, as we know. If we do that and we're smart about it, we're going to come out of this actually great. Although 2020 will be viewed as an extraordinarily difficult year for us as citizens and just members of the human race. So I hope people understand that when I say we're all in this together, it's not cliche. We actually are all in this together. Some people will suffer more, of course, because they didn't have as much opportunity beforehand. Some people are continuing to suffer because they are in a devastating homeless situation, and I'm sympathetic to them. It's also terrible to deal with the realities of the homeless surge going towards your community. I get that. That's why we should be fixing these fundamental underlying problems before we get these crises, not after. And we can take that up on a different hour, I think.
Thank you, LG. I know we have time for about one more question, and I see Shirley's hand has been tagged by the moderator. So go ahead, Shirley.
Aloha, good evening, everybody. I have a question around the testing. I heard Josh from City and County says that Hawaii has one of the best testing among the country. And at the same time, have we reached a third of our population in testing? Because we go back to the 8 drivers that is that can pass the disease without having symptoms. And we also have skewed numbers if we have only taken 3,000 tests out of, I think Waianae population itself is 6,300, 63,000, maybe higher now because of the new developments. But I don't seem to believe that the test is in proportion to the population. And with that being unknown, there's also been people reporting that they had mild symptoms, but yet because of the low access to testing, they have been turned away from testing. So I'm really curious as to what are our real numbers and how close are we getting to get a real picture of the 1.2 million people or however many people we have out of 5,000 tests. How can we make
Well, thank you for that. We've done, you're right, we have not done enough testing. Had we stuck with the Department of Health strategy from the beginning, we would have only done 400 tests total, which was a disaster in the making. So I was able to activate the private sector, and we've now gotten up to 25,000 tests. So we're in the top 3 per capita nationally, though we don't compare at all to what Korea is doing or other countries, which I support their approach, which is test everybody possible and then not only isolate as we're doing, but you also can provide even better quarantine for people that live in multi-generational families and households. The truth is, in every rural area, like I was the doctor in Ka'u for 4 years, so believe me, I know exactly what it's like to live in a rural area and provide healthcare in a rural area. We always have fewer access points to healthcare, which is one of the fundamental inequities that we face when we're in the rural areas. The fact that we finally got to about 25,000 tests, which is about 1.8%, I think, of our population, is beginning to give us a picture of the underlying disease, plus the number of people that we see or don't see in the intensive care unit on ventilators also tells us what the real picture is, because we know for every 1 to 200 people, you end up with an individual on a ventilator and usually dying. So we have not seen that number of deaths, so we can reflect that we don't have a massive number, though we're learning a lot about this virus. And it could very well be, we may find that later 9 out of 10 people were asymptomatic. That is a possibility. And that those asymptomatic people had, of course, very minimal disease, yet they were at risk of spreading it to one of our kupuna. And then, you know, the mortality rate's 14.4% for people who are 80 or older. It's 8% for people between 75 and 79. So these are some of the many risks. We will have the antibody tests in a few weeks. They're getting tested and vetted across the country. And every day I try to find a way to get us some of those tests, as long as they're accurate. We don't want inaccurate tests, because if they're inaccurate, then people might have a false confidence. But I would like to get to 10% of the population tested at least, which is what Iceland did. And they were able to then characterize exactly what they had to deal with. You make all the great points that, frankly, that I think about every day.
Yeah, I would just add to that, you know, obviously we're doing more testing than 47 other states are. We would love to be doing more testing than that. And honestly, if the federal government was able to get us more supplies and get us stuff, and you know, in the beginning, get us stuff that was quality stuff, we would be able to do that. So I think this is a little bit, you talk about a rural community and can-do attitude. I mean, I think we're kind of just MacGyvering this as we go, and we've been able to do a better job than other states and communities, but we're not getting enough air support from, you know, the federal government to meet those kind of standards and numbers that we would all like to see.
Thank you.
Thank you, Shirley.
Cedric, should we move on to the next part of our agenda at this point?
Yes, I want to respect LG and Josh Stanborough's time. I want to thank you guys for joining us for the short time we did have. I know we will be planning on doing more virtual town halls in the near future. So if we could get some type of update or include you in that, that would be awesome as well.
Thank you.
Happy to. Yeah, thanks so much. And thanks, Councilmember Pine and Senator and Representative, for pulling this together. I hope every single community gets to have sort of a MOCU discussion like this and help inform and give us feedback. We'll take it. Appreciate it.
Great.
Thank you, Josh.
And any questions that that do come up that we can forward over to you, we'll also get that to you as well in writing.
Yeah, absolutely. Hey, and just so everybody knows, if they have a question and the call center is not up at the time you want a question, you can email a question, COVID response @honolulu.gov. We've got staff manning the emails all the time, trying to answer questions. If we don't have an answer, we'll try to find it, because if you have a question, guaranteed there's another dozen people out there that have the same one, so we need to get it answered.
Guys, just call me directly if you have any need, okay? I'll be there for you.
Thanks, LG. Thanks, Josh Stambro. And we're going to go ahead and move on to our next agenda item. We have a presentation from Senator Shimabukuro.
Thank you so much. You know, what I want to focus on is people in the audience who are really struggling financially right now. I know many of you have been laid off of work and are finding yourselves to be in much financial distress. And the good news is there are some resources out there. Our state welfare office has made some dramatic changes in response to COVID. And the first one is that the temporary assistance to needy families, which is, you know, financial assistance for children, is going to exempt unemployment benefits during this COVID crisis. So this is really big because normally if you receive unemployment, it counts as income and you're not going to be eligible for financial help from welfare. But during this crisis, you can. And I know for many of you, you maybe have never received welfare before in your life, and don't let your pride get in the way. You know, I can tell you that my mother was on food stamps and a legal services client when she first found herself as a single mom after her divorce. And so I myself am so grateful that the state was there for our family when we needed it. And so please reach out. If you need to apply for welfare cash assistance as a parent, again, unemployment will not count as income during this time. And you can go to the DHS office nearest you. Here in Waianae, it's in the Waianae Mall. It's the Ka'ala unit, and there's also the Waianae Processing Center, just to the right of Fantastic Sam's. The welfare office also is really liberalized its childcare assistance. So they have, you know, this thing called Child Care Connection, which is where you pay for your childcare, then you get reimbursed. And similar, they've eliminated income requirements. They've eliminated activity requirements. Certain people are going to have no co-pays anymore. They'll hold your spot for you. There's also, for essential workers, there's Patch has lists of childcare providers that are there to help you. And Preschool Open Doors has extended their deadline till April 30th to apply. Now, again, this is all through the state welfare office, which is for us in Waianae in the Waianae Mall. Another great resource for those of you in financial distress is Liliuokalani Trust. And many of you might know them. They're off the highway off Ayong Homestead Road, near in that area by Farrington Ayong. It's formerly called QLCC. They have Emergency Stabilization Financial Assistance Program. And this trust was set up for those with Hawaiian children. So any child, if you have a child 0 to 17, and you have been directly impacted by COVID-19 financially hit, then you can contact Liliuokalani Trust, and their number is 466-8102, 466-8102, or email covidhelp@onipa'a.org, covidhelp@onipa'a.org. So again, it's financial assistance for those struggling right now. There's also an organization called Modest Needs that gives out $1,250 per year to low-income and other struggling families and who at this time are affected by COVID-19. And their website is modestneeds.org. So again, modestneeds.org to apply for an annual grant. Exciting news, so I just wanted to share that this coming Saturday, Malama Makua is teaming up once again with Waianae Store, and they're going to be doing face mask distribution. And they are doing this at cost so they can at least recoup costs and then purchase more face masks. So it's going to be this Saturday, April 25th, 4 to 7 p.m. in the Waianae Store parking lot. And it's going to be $10 for 12 masks. And please bring cash and exact change. And then finally, I want to end by, sharing that, as you may have noticed, if you drive past, Ke'au Beach, you'll see that the state, DLNR and DOT have blocked off parking to Kula'ila'i, Makua, and Ke'awa'ula. And, as was discussed earlier by LG and the mayor's office, this is for your safety, so just know that, yes, there's gates and they've blocked off the parking areas, but you can still access the ocean if you park outside of those areas or access by foot or you're dropped off. Okay, but in this time, I'll move on now to Rep. Gates, pass the mic. Thank you.
Thank you, Senator. Appreciate the update. Thank you for covering a lot of ground with your update as well. For me, I know that unemployment has been the probably #1 concern my office has been receiving, and we are constantly keeping updated and trying to put out the most accurate information and up-to-date information that we are receiving from the Department of Labor. And we understand also that this is a lifeline for many residents to pay their bills, to put food on their tables, which is why I've been voicing our concerns directly to the governor's office, as well as the department. And recently I just applied through the Hawai'i Works program to actually process claims at the unemployment office where they're actually setting up at the convention center. There are, as LG said, 200,000 claims that still have not been processed and that are pending, and that's why we need as much kokua as possible. And if you are a state employee, please visit hawaiiworks.org and please apply to volunteer if you're able to do so, because the faster we process the claims, the faster people can get money in their hands and do what they need to survive during this crisis. So we will also be posting the links to the website to check on your claim, as well as the 3 emails that the department has set up for people who have either been rejected or have questions regarding their claim. So that's going to be posted after this video, and we're going to post it on our social media. Regarding just community assistance, I know that a lot of people are in need of food, especially, and prior to COVID-19, 40% of residents in Waianae identified as food insecure. And as we know, with this crisis taking hold, it's probably a lot greater than that now, which is why we've been assisting nonprofits in getting resources and connecting them to resources. Our office has also been volunteering wherever we can to make sure that we get the resources and assistance to our community at large. Along with COVID testing, I want to shout out Waianae Comprehensive Health Center, who is doing an excellent job to provide opportunities to our community to get tested. You can call them and schedule an appointment to get tested if you're in need of one. I know Waianae Comp will go into a little bit about that, but our office also was down there at Waianae Boat Harbor, assisting in the COVID testing that took place there last month. And so we're also listening, along with all of the volunteer work that my office has been doing, we're also listening to community concerns, and we're hearing the concerns coming out of the community. Some of the concerns I do want to highlight to make sure that the community knows that we're aware of these issues. One of the bigger issues that came to my attention was that the Bank of Hawaii and First Hawaiian closed their branches in Waianae. So we sent a letter to them requesting that they open that up as well to provide access to our community, because the next location is in Kapolei, which could be an hour for residents to get there. So we're going to continue to press on them to get those branches back open. I know we've been also monitoring illegal dumping and abandoned vehicles that has been taking place on the Waianae coast. I have been out there taking photos and sending those to the city. We're also looking at ways to coordinate a cleanup ourselves to help with the issue of these abandoned vehicles literally popping up everywhere. Now, the last thing on that issue too, I want to make sure that our community is, again, saying something when they're seeing something, because we need to catch these guys and hold them accountable. Some of these cars look like they've been dropped off and abandoned in our community, and these are the people that we need to make sure that we're helping HPD catch. And also, one of the things that I've been doing is staying in close contact with DLNR as well as DoCare and HPD regarding enforcement issues. I know that has also been a big issue in the community, and we see the videos of people at icy ponds trying to camp there, and it's on our community for bringing that up that we were able to, alert HPD and alert Board of Water Supply. So I'm just going to continue to encourage people to let us know what you're seeing in the community, because we can't be everywhere. And then Finally, we are also working on addressing the homeless issue. I know that we've been in contact with HPD, Kahumana, and Waianae Comp to coordinate an effort to try to provide some stabilization and some type of housing for our most vulnerable populations in the community. And again, we're always working. So if you have questions or concerns, you need to get to us, you can reach us by phone at 586-8460 or repgates@capital.hawaii.gov. We'll also post that information below after the video. And I think that's my time. So mahalo, everyone. Thank you for joining us today. Councilwoman Pine, you're up.
Okay, aloha everyone. Can you hear and see me okay?
Yes.
Great. Well, thank you for allowing me to join you folks tonight. I just love getting together with the Waianae Coast. I miss everyone a lot, and it's just been nice to see everybody today. I want to give you an update of what I'm doing on the city side. While I appreciate, of course, our leaders making sure that our health is taken care of, as the chair of Economic Development and Tourism Committee on the city side, I'm focusing on how we're going to get Hawaii back to work. I think we cannot deny the negative economic impacts this has had to so many of our residents. I have had to handle so many calls from people, as Miley talked about, where people are truly suffering financially. So we must not ignore that we need to address this now. So tomorrow, I hope all of you folks can join me. We are having a town hall to discuss getting Hawaii back to work. It's part of our Hope and Healing During Crisis series. And we're gonna be having Dr. Tusi Abegalado from the University of Hawaii School of Business. He has the Pacific Islander innovative section. And of course, we're gonna have Sherry Minoru McNamara, who's the head of the Chamber of Commerce of Hawaii. We're gonna talk about, so what's this gonna look like when we open up again? How can we open up again? What kind of businesses are we gonna have in the future? Is tourism dead? I can tell you, before this crisis happened, responding to so many of our constituents, especially on the Waianae Coast, where some of the most beautiful beaches are in the entire state, that we feel overrun, that we feel that we have lost our private spaces, that our valleys are being destroyed, that our oceans are being destroyed by just too many people coming here from other places. And so we talked about that before this started, and we revealed back then that in 1980s, we had the same income, but half the tourists. So something really went tragically wrong, and people got greedy and they ruined tourism for us. So the best time for us to get back the Hawaii that we truly want in a crisis like this, when we can be innovative, when we can start standing up for our rights and say, wait a second, this is a little too much. We need to find a better way to run this economy. And as everyone's seeing, 40% unemployment, the highest in the nation. We have set our state up to fail in crisis. And so as we look to the future, we need to ask ourselves these creative questions. Instead of focusing on what we have lost, we can now restart in focusing on what we can gain. So I hope you folks join me tomorrow at 1 o'clock. I'd love to see how you respond to these brilliant people. Dr. Tusi, of course, I think you've learned by now that I always have a traditional intellectual on my show, and then I have someone that's very connected to the history and culture of the Pacific Islands. And Dr. Tusi, of course, has elite heritage from Samoa. And so he's gonna be giving us some knowledge and truth-seeking, while he also combines his capabilities to promote business, but through a Pacific Islander perspective. So I hope you folks join me tomorrow. I look forward to hearing more from all of you tonight. Thank you.
Thank you, Kim.
Thank you. Now we move on to Waianae Comprehensive Health Center. Next. Hello.
Great, thank you so much. I think we're going to pull up on our PowerPoint that we put together. Rich is gonna unmute, and I think Rich is gonna start us.
Okay, am I muted?
No, we can hear you, and our PowerPoint is coming up. Rich, you just gotta tell them when to change the
Okay,
slide.
I wanted to say something about, I wanted to back up Josh Green and what he said earlier, and I was trying to make a comment. I had just read a study, a John Hopkins study on Sweden, and it's a country of 10 million people, and they've had something like 1,400 deaths already. Their incident of the virus is spiking up very rapidly. They have higher rates of the disease than their neighboring Scandinavian countries. So in all due respect to the surgeon that called in earlier, I think there is this, I think we really need to listen to our lieutenant governor and our state officials, because I think they're providing really, really good information. And I do think there is sort of a populist movement out there to discredit the efforts to stay at home. And I don't think it's valid. So I just wanted to back the lieutenant governor on that and sort of take a look at the myth that somebody else presented on Sweden. Okay, are we ready with the PowerPoint? Can people hear me?
Yep, we can hear you. You can just tell them when to move the slides. Yep.
Okay, so it's Monday, April 20th. Move the slide.
Very good.
So about 6 weeks ago, we started working on this, and we had three main goals for the health center. Keep our 700 employees safe, to continue to provide needed medical, behavioral, and social services to our community, and to sustain the financial viability of the health center, not only right now, but not get ourselves into debt as we move forward to keep the health center healthy. So with that in mind, we have regular morning meetings with our key staff, with all our department heads, and we are organized and ready to respond to this. So roll the slide. Next item. So one of the key things that hits on all three of those goals: keep employees safe, provide services to our patients and our community, and keep us financially viable. And let me say that we have two big roles in our community. We're the largest employer. Our payroll is close to $1 million a week, and we employ primarily people from the Westside and largely people from Wai'anae. So that is one of our goals. We do 220,000 clinical visits a year. So keeping that in mind, how do we keep our employees safe, deliver the services, and stay financially viable? The number one thing, we're doing a lot of things, but the number one thing we're doing is telehealth. And this very simple chart, if you look at the far left side, it will show you as of March 1, how many total visits we were doing at the health center. And each one of those visits, not only does it serve people, it contributes income to us and to the microeconomy of the Wai'anae Coast. So what we did, and mahalo to the Department of Human Services, to the Quest Medicaid Agency, for allowing us to be paid for telehealth visits, not just face-to-face on-site visits. So if you look at the two, the brownish and the goldish part of that, you can see by looking at the green how much our face-to-face visits have dropped. But if you look at the middle bar, that is telehealth using new technology that we've rolled out, where everyone in Wai'anae that needs care, we can connect them, at least on the doctor side, and we've trained 100 doctors to do this, and other healthcare professionals. The bar at the top is what we're also able to serve people that just have a telephone. So this has been an amazing 6-week conversion from being brick and mortar medical clinic to a telehealth digital service center for people. Last slide. Third slide, Nick.
Yep.
So what are our immediate concerns as we move forward? Again, the economic well-being of our employees. We have furloughed, and these are very valuable employees that, to keep them safe, they're at home, and they're not able to do their job at home because of the nature of their work, but about a third. And I am really happy to hear tonight that the unemployment process is going to be expedited, because so many of our people that we have furloughed can't get through to unemployment. And so it's really great that beginning Wednesday, there's going to be a major ramp up of this service. So it's really important to not only the individuals, our families, but the people along our coast to be able to pay groceries and pay the bills. Secondly, I'm concerned about our emergency department. And this is both with the legislature closed and we cannot secure additional funding. The key here is we've had at least 3, and now I understand 4 of our key staff, doctors, nurses, that are also in the military, have to go back to work in the military and cannot work in our ER. We're flying in doctors from the continent to keep the ER open. We need to have Department of Health, excuse me, I got 5 seconds left on the battery, 5%, perfect. Anyway, we need to sustain these ER services, and I'm begging our legislators to help us in this. And finally, community education. Don't believe what we hear about Sweden. Listen to Dr. Green and others. Let's stay safe. And let's learn to use telehealth. And we've got a new team of people that are ready to train our kupuna, ready to go find broadband contracts for them to expand their data capability to participate. Let's keep our community safe. It's the most important thing we can do. Nick, maybe you can go into some of the specifics about what the COP is doing in terms of operations.
Thank you so much, Rich, and thank you for your years of leadership and commitment to our community. If you go to the next slide, I will go into detail. I'm really thankful to our Kapuna because and our founders who put comprehensive in our title even before we were comprehensive. They set a vision for us to go to. And so with us being a comprehensive healthcare and social service provider for our community, we're here in the good times and the hard times, and we're here for everybody to try to meet it, whether it's social services, telehealth, etc. So I will go into detail on some of these services, and let me make a big important slide on this slide. All of our services that I'm about to mention are available to our community. You do not have to be an existing Waianae comp patient to access our services. We know some of the providers in our community have closed down or moved their shops. But if you've never been in a service with us or hadn't been with us a while, you can still access our services. We are open to you and welcome you with open arms. And of course, folks have been with us forever. We can go to the next slide. We have a hotline that we set up from day one because we wanted to be here for our community. So you can call this number and we'll put it in the chat box, but 697-3170, 8 a.m. to 8 p.m., 7 days a week. We have healthcare providers here who can answer general questions for you, can do screenings, can set you up with services, can help you with refills, get you set up. If your screening is for an appointment for a COVID test or anything you need, but we are here to make it easier for you to access in these uncertain times. So call that hotline if you have any questions. Again, you don't have to be an existing Waianae comp patient. Anybody is welcome to use that service. We also have a drive-through that is open 5 days a week, 8 a.m. to 12 p.m. so that we have testing that's available. We've also been expanding that service to help people who don't necessarily want to go into the clinic to receive, services they might ultimately need. So that drive-through is there every day, 5 days a week for you and the community. You can access it by calling your primary care provider, or you can call a main number, or you can call the hotline. We have lots of access points for you for that. There's information there that tells you all about, what you would need. Next slide, please. In addition to all of that services, we have a pharmacy curbside pickup for here in Waianae and Kapolei. If you need to get your prescriptions refilled and you don't want to come into the clinic because you don't feel well or don't feel comfortable, you have all the instructions of how you can ultimately get your prescriptions at the curbside without having to come into the pharmacy proper. We have all of that in place for you. And we encourage everybody to access that service. Pharmacy is a big way that we are able to reinvest back into our health center. So the more folks in our community that use it, like Rich said, it goes right back into the economy of our community. And so we're trying to make that easy for you. Next slide, please. In addition to that, we do have home delivery services for your prescriptions here from Nanakuli to Makaha. So we are really trying to work with you in any way, shape, or form to make sure that you can stay at home, stay safe, and also receive those medications that you need to stay in good shape. Next slide, please. Like Rich said, telehealth, video, and phone visits. You can call your primary provider. You can call 697-3300, or you can call our hotline if you want to see your provider. And so what we are seeing is that we ultimately are starting to see about 65% of our patients in total accessing their health care. That means 35% of people are either delaying care or they're putting it off. And so we're going to be more aggressive about trying to reach out to people, because if you do have a chronic condition and you don't stay on top of it, it's only going to worsen the situation for you and the community later. So we really want to get that percentage of people who are accessing services up so that we don't further exacerbate any issues. And so we do have this mechanism. And like Rich said, we've been able to stand this up in a very fast fashion. It's very good. It's very competent. And if you don't have all the technical stuff for video, we can do a phone call, but we'd like to do the video too. So we've stood it up. Next, please. Next slide. I also wanted to transition to stuff that we're doing in the community in regards to the unemployment and all the issues and just being there for our community from the social service standpoint. Since March 25th, we've provided 34,800 meals, 18,500 pounds of pantry items, 12,273 pounds of produce. And so what we've done with this Keiki Grab and Go is that we started with 3 sites on March 25th, Hawai'i, Kamaile, and Lehuku Elementary. And then on April 6th, we extended to 2 more sites, Lehuku, Waianae, Ohana, and Hawaii Vista. And what we've been able to do is we've been the trailblazers to go into the sites that the DOE wasn't able to set up fast. We were able to go in, show that there was a need in that community. Then the DOE's partnered with us, and they're moving in to step into those new places that we've shown the need. And then we're able to move further down the coast. And that's really been the model. And I thank our community folks for that, that team that's putting that together. So we can go to the next slide. So very important, we have these grab and go meals and pantries. Okay, we have it 5 days a week. Drive-through distribution of 5 take-home meals and 2 bags of fresh local produce. So if we can go to the next slide. On Mondays, we're at Waianae Elementary and Waianae High School. You can see the times there. So please note those times in our partnership with Hawaii Food Bank and many other organizations, which I'll mention later in our presentation. On Tuesdays, let's go to the next slide. And we will go to these fast. Maile Elementary and Ho'ana Makaha. So that's listed. Next slide, please. Wednesday, Waianae Intermediate and Lehuku Elementary. There's the times listed. These are services. Thursday, Nanikapono Elementary, and on Fridays, Kamaile and Nanakuli High and Intermediate. So we are all throughout the coast on those important services. You know them. If you have questions, again, call our hotline, call us, we can access it. Next slide, please. Patient assistance services. This is becoming even more critical. We are trying to be forward-looking. We are very in tune to the fact that we have unprecedented unemployment. We've been working with DHS to look at how we can assist in that, and also the services. In addition to the services that are listed there, there's medical insurance, SNAP, financial. We also, through a partnership with Aloha United Way, can offer rental assistance, and we'll put that number in the chat box. And so we're trying to be truly comprehensive. Next slide, please. We have WIC services, which are totally can be done on the phone now. You can apply and receive your card, your e-WIC cards. We're the largest contracted WIC provider in the state. We have that service run in a way that you keep people stay at home and safe. Next, please. We also really want to thank our community. We've had so many people donate and give their time and energy and to support our staff. And I just want to note that in addition to how gracious it is to the support, it's a real staff morale boost to hear that the community is appreciating and understanding all the work that we're doing. So I encourage you to continue to do that. It's truly appreciated, and it makes a really big difference for our staff. So mahalo for that. Next slide, please. This is all the donors, a list of all the donors that we've had since the COVID. And you'll pay particular attention to the feed distribution keiki feeding program. It truly takes a village to meet the needs of our community. Everybody stepped up. We had everyone, Hawaii gives 50,000 surgical masks. Hawaii Dredgings helped us with our drive-through. We've had so many folks. Campbell, of course, has always been there for so many people contributing. And so we're so graciously appreciative of that. And we're still in need. So next slide, please. I'm almost Paul. We still are looking for donations as it relates to our food distribution program, our homeless outreach, medical supplies, and our support around COVID. And so we are greatly appreciative of any of that. It's on you can donate on our website. There's information you can follow up. And we also, last slide, please. That's it. So thank you so much. I just want everybody to know most current way to update is the website and social media platforms. We're always sort of updating what we're doing. I'll turn it back over to Rich for a quick comment.
Actually, I think we said enough. I'd like to thank very, very much our legislators, our city councilwoman, the support they've given us, and the networking we're doing in the community is tremendous. So thank you, guys.
Thank you, Rich, and thank you, Waianae Comp, for all you guys are doing for our community. Time of need. For the next presentation,
Thank you, Rich.
we have HPD. Sergeant Kaikina, you want to go ahead and give us a update?
Like I said earlier, I'm Sergeant Mike Kaikina from the Kapolei Police Station. I'm the supervisor for the community police team. One of the biggest things that we're doing right now is trying to organize with our Westside delegates like Cedric, Senator Shimabukuro, and Stacey Eli with regards to our homeless situation. I think Tom McDonald is going to explain more about what we have coming up, but the beautiful thing is that when we all partnered up together to try and get this thing done, you know, it came out to where the location that we're going to have the homeless at is way better than we anticipated. So thank you all who are involved with starting this whole entire situation with regards to our homeless. The biggest issue that we're having right now is once the proclamation came in March, that really stifled a lot of our enforcement with regards to our RCPs and the beach closures that we're trying to enforce right now. I'm very happy that Mr. Stansbro had clarified the enforcement that we were doing, and we just wanted to make sure that how our enforcement was going was actually correct. And after he clarified everything, we're very happy that what we were doing was the right thing to do. After the proclamation came down, like I said, a lot of our enforcement with trying to get our RCP some help, trying to get them into shelters, trying to clean up our beaches and whatnot, that literally stopped a lot of our services. Our department and rec people, they couldn't go out and meet with us with regards to our standard property ordinance sweeps that we were doing to clean our parks. But Mr. Stansbro, you can let Mayor Caldwell know that we're very appreciative that he's starting it up again. So we have our first SPO tomorrow down from Lahi Lahi all the way to sewers that we're actually going to start tomorrow since the proclamation came in August. So it was such a relief to find out that Mayor Caldwell had put the SPO crew back to work. So very happy that we can start to move in that direction to get our homeless people some help. The biggest issue, like I said earlier, that we're having is with all of our enforcement that we're trying to do with regards to closing the beach parks. It just seems like a lot of these individuals that are coming to our beaches on this side, and a majority of them are not even residents from the Nanakuli, Waianae area. They're actually people coming from town, Pro City, the Windward side, Kailua. Oh my goodness. but it's hard for us to do our enforcement when they don't listen. Like I said, from the time of the proclamation started up until now, we've issued over 1,100 citations. And we're kind of hoping that with that much enforcement, people would get the message, but apparently they're not. So I'm happy, like I said, that Mr. Stansbro had clarified what we were doing was correct. And we're gonna keep the enforcement up, do the best that we can. And hopefully we can go back to normal sometime soon. So if you guys got any questions for me, by all means, let me know.
Mahalo. Thank you. And I just got a text from Tom. He had a family emergency and is unable to join us tonight.
Okay.
So we're gonna go ahead and skip to our next presenter, which is Joseph Lapolio from the Waianae Economic Development Council, to give us a little update on the business aspect for our community, our small business.
Okay, thank you so much, Cedric, and thank you, Miley and Kimberly Pine, for hosting this event tonight. Really appreciate it. My name is Joseph Lapilio. I am with the Waianae Economic Development Council, and I wanted to share just real brief, because I know time is really tight, of what we can do to help the businesses in our community. The Waianae Economic Development Council focuses in on businesses in the community, and although we did have other things that we're doing like everyone else, over the past month, a lot of our work has shifted into helping businesses in the community with either information, technical assistance, or whatever other help they needed. So let me just, so we basically do several things. We have a program called Bait on the Waianae Coast, where we're helping businesses in the community market whatever products or services they have. And we are right now an emerging community development financial institution, and we're looking at providing financial assistance to businesses in the community. And along with that is application assistance with the payroll protection plan, and also with the emergency injury disaster loan program. Now, I think as all of you know, the PPP, the payroll protection plan, has basically run out of money. And right now, Congress is looking at another bill coming out. And from what we're hearing, I haven't been able to see the news today, but it's expected to pass the Senate today and move over into the House of Representatives tomorrow, with passage on Wednesday. And that's if everything goes well. In the last allocation to the PPP and to these loan programs, about 1/3 of $1 trillion was allocated for businesses across the country. And I think, as all of you know, that money ran out pretty quickly. Now, we have contact with about 200 businesses on the Waianae Coast. And over the past week, we've been able to survey them to find out what the situation is with them. And we found that about 1/3 of the businesses that we work with have had major adjustments to their operations. And as you can imagine, many of those, I mean, in fact, pretty much all of those are restaurants. A lot of the drive-thrus we have in the community basically operated as takeouts. So a lot of their business may have dipped, but they're pretty well functioning. The others, where you would actually go in and sit down, they're hurting pretty badly. About half of the businesses we surveyed are sure they're going to be remaining open. About 1/3 of the businesses we work with are unsure. And about 1 out of every 5 businesses in the community are looking for some kind of help for them to be able to reopen, with 75% of them looking for financial support. So what I wanted to be able to bring clearly to everyone is, when this PPP funding does come through, it is extremely important that if you are thinking of applying for the program, you need to do so very quickly. About 1/3 of the people we surveyed applied for either the emergency injury disaster loan program or the payroll protection plan. And all of them are basically waiting. By the time they had gotten their applications in, the money had run out. Now, in my conversation with some of the banks who are helping to facilitate the loans, if you did submit an application and you did receive a registry number, you will remain in line. And as long as the rules remain the same, you will be able to, I guess you'll be in line to be able to work with the bank to get your loan approved. We do have a couple of businesses out here who have had their loans approved, but have not received any funding because there was not funding by the time their loan approvals happened. So what I did want to bring up is that if you need any help, you're a business and you want help with your PPP application, we do have people who are available to help you with the application. You can give us a call at 808-460-7922, and we'll be able to help you with any questions you might have. We can kind of steer you to any information if you have some kind of specific business needs, or maybe you're in an industry, we can help steer you towards support programs or funding available to you specifically. We can help you with that as well. So give us a call. And again, I want to wrap with that and mention to our legislators and the Congresswoman, the Councilwoman, thank you so much for inviting us so that we can get this word out. Mahalo.
Mahalo.
Thanks, Joe. I know we have about 10 minutes officially on the schedule, but I definitely would like to still have a time for Q&A after our next two presentators. So with that being said, just wanted to put it out there. We're gonna have Ma'o. You wanna go ahead and provide an update to the community on what you guys are doing in the food sustainability aspect, as well as the employment aspect and the community aspect, because I know you guys are doing amazing work.
Yeah, well, aloha everyone. My name is Kawi Sana. I'm currently the farm manager at Malt Organic Farms. Currently still on the farm. Just wanted to make sure that we can. I don't know about Ma'o. We're a nonprofit organization serving the community by growing fresh organic foods, and we also have a youth leadership training program that sends young adults from our community to Leeward Community College, and some students are attending UH West Oahu, and we give them a food stipend. They work on the farm, and for their sweat equity, we pay them an additional to their tuition, a monthly stipend starting at $525. Their interactions on the farm help them to create leadership skills and to be entrepreneurs and to aloha aina and be aina warriors and to just grow food, feed families, feed our community. So a few updates from us is, yeah, in the past month, we've seen just a lot of community outreach to wanting to support our farm and other local farms. So like, you know, a neighboring farm for us is Kahumana. There's a lot of local farms all over in like Waimanalo and stuff and such like that that are getting a tremendous high demand of getting local produce into their homes. So our CSA program, which is like a monthly box subscription or weekly box subscription that people can sign up for, pre, you know, the lockdown, we were probably doing about 60 to 70 box a week, one box going to each family. Now for this week, we're doing 250 and the numbers are still climbing. So more people are finding or wanting to have a local direct connection to their food source. So, you know, I think Councilwoman Pine was like, she kind of posed a question to me that kind of caught my ear, and she was really talking about like, you know, with this pandemic happening, it really kind of shows how vulnerable our systems are in terms of like, they're not resilient. So to be able to be in a space, like thankfully for me and some of my coworkers and the interns that are still working here, they have a space where they can still get, you know, their tuition paid. They still have a space to find access and resources to go to school, because now basically all colleges are virtual and online, which is really hard for some of our young people because they lack the resources. So we're finding resources in every small nook and cranny to help support them. But then we're with the high demand, we now have opportunities to like really invest in our young people and in our community to provide more jobs. With that, we need more funding and we need more opportunities and collaborations with you know, we're still a business, so we're trying to figure out like how can we things that could help us in the short term that could really be really big investments in our young people in YNI to continue college, but to have them as to have some kind of income to provide to their families. And a lot of our young people, we're providing fresh organic food for them to take home, and they're super stoked about that. So right now our sales is pushing towards to like $20,000 a week in terms of local organic, like fresh organic produce going to our community, and on the island of Oahu, because we do outreach to places like in town and Kailua and in Kapolei. So to me, there's just a big, you know, opportunity for us to invest in our community, in our aina, you know, so to have more aina in production is a big part. And we recently was able to, in collaboration with a few partners, be able to purchase 250 more acres. Communities help to, we're looking for new recruitments for the summer for our youth leadership training program. So if young people are really up in the air about, like, especially the high school seniors, which my heart is sore for because graduation is a really big thing for a lot of our families on the West Coast and just a lot of our local families. You know, if a question of college isn't, like, if that's a question, we do provide tuition. We provide a little bit of a monthly stipend to help through these kind of challenging times. But in that experience, we hope people can get out these leadership opportunities and this kind of give back to our aina and to our community. So yeah, we're pumping out food. You know, we need all the support that we can get, and we're really humbled to be in a space where, you know, unfortunately, like, we see like how tourism has took a toll on a lot of our families and having jobs. And, you know, I'm really, really humbled and I feel really lucky that I can be just working on the land where at some point during our history, working on the land was the lowest job you could get. But here I am having a job and providing a safe space for our young people to grow, to eat, you know, to provide food for their families, and, you know, to just expand on what that means of, like, what is it to build a resilient community and what it is to build a resilient programs. So we're here. I'm here for any questions, and I'm just super stoked to be from YNI, and YNI forever, YNI strong. Yeah, mahalo.
Thank you for that. Okay, so we're gonna move on to our final presenter, and
actually,
that
Cedric,
is,
sorry, Scott Ward, unfortunately, Chair Resentis is unavailable at this time. Maybe her time is, I know she has a very busy schedule.
oh, okay.
Yeah, I just got a text, so maybe we can go.
Got it. So
yeah.
for on that note, I'm gonna have Jimmy from my office go a little bit over the census presentation that Chair Resentis was supposed to give. So go ahead, Jimmy.
Yeah, absolutely. So I'll keep it super quick. Aloha, everybody. My name is Jimmy from Rep Gates' office. Wanted to remind everybody that the census is still going on, that we really want everyone to fill out their census forms. Making sure the Waianae Moku is counted is crucially important for everything from funding to hospitals like Waianae Comp, repairing Farrington, making sure our Social Security benefits, Medicare benefits are coming in. So go to 2020census.gov for more information. Due to COVID, the deadline has actually been pushed back to October 31st. So you have plenty of time to respond to that form that came in through the mail via phone, online, or through the mail. So again, go to 2020census.gov to fill that out, and let's make sure that Waianae is counted. Thanks.
Mahalo, Jimmy. Appreciate that. Okay, with that, we're gonna go ahead and open up for questions. I'd say give about 15-20 minutes for questions. So we'll go ahead. I see John Doe has his hand up. John Doe, are you still there? John Doe?
I'm still here. Yeah, you can hear me.
Yep, go ahead.
Okay. Hello everyone. I just want to thank you guys all for your service and just all your service in getting through this pandemic, COVID pandemic. But trying to start my video here, but I just was wondering for in terms of the SPOs, the homeless sweeps, is Keao and I know you mentioned stewards to Lahi Lahi, but is Keao to Ohiki Lolo included again because it's ramping up over there. Of course, the illegal activities and all the illegal dumping is continuing after all the multiple cleanups. As you can see in the Protectors of Paradise background, that's metal pile still there, and there's with that van, there's 2 other cars that have been added to that pile. And if you can see just real fast behind me, this picture is, you know, Cedric, the guy that we kicked out the chop shop at Waikomo's. This is what he's starting back up at Keao right now. And also he moved back to Waikomo. He has his tent and he's setting up again over there. So, you know, yeah, it's definitely ramping up at Keao, and we just like to know what's the word on that. And also in terms of having more, somehow getting more enforcement, as was mentioned, more HPD for the whole leeward side. But how can we enforce Keao to at least Ohiki Lolo, or if not all the way to Kaena Point? I know that's state and do care, but just want any update on Keao.
Yeah, so I'm gonna go ahead and ask Sergeant Kahikina as well as Councilwoman Pine to chime in. I know that's the city area, so we've been working together. Thank you to Protectors of Paradise as well for helping our community, you know, take care of the Aina and do our part to try to be a part of the solution. And I leave it off to Sergeant Kahikina and Councilwoman Pine for this question.
Thank you.
Sarge, you want to go ahead and answer about Keao and Waikomo area? When could we see enforcement taking place there? And you know, what are we doing to curb the increase in illegal activity is what I believe Jonathan was trying to ask.
So like I explained earlier, once the proclamation started, everything had stopped. We were still enforcing the park closure laws along the coastline, even with regards to the unimproved area at Keao's, but we couldn't displace anybody. The Honu had stopped because of the situation with the post program that's going on right now. But now that the SPO is coming back and the mayor had just released the crew to start the SPOs, we're actually going to start tomorrow. So we are going to now focus everything on the unimproved area down at Keao Beach Park.
Okay.
I think Mr. Reeve had his hand up.
Councilwoman Pine, if you could also respond to some of that as well. Sorry.
Okay. Thank you very much. One of the things that I've been working on is creating a possible new zone in the city and county of Honolulu, and that's tiny homes. I don't support just, you know, not having a very orderly manner of just putting people in one place without a lot of support around it. I think we need to prepare for the possibility of more homeless because of the financial crisis that is going to result from this situation. Right now, the city just released a $2.5 million grant that we got as part of the stimulus to assist in the homeless population. And I want to let Sergeant Kahikina know that we do have several community groups that are applying for that will assist the work that he's doing. So we're not just moving people from one place to the next, one beach in Waianae to the next beach in Waianae. We really want to come up with a solution. Of course, our elected officials are meeting tomorrow to discuss this possible solution. There's other people that are putting grants too across the island. So if we certainly want to get this grant, and we're going to have to all work together. So several nonprofits of Waianae have decided to start the discussion at least of how they can apply for this grant. I hope they get it. They're the most qualified on the whole island to understand the homeless population, and our police need our help. They're frustrated. They're absolutely frustrated that they remove people in one place and then they're just in the next beach. And then we have another crisis with our community that's down the street. And so we really need to end homelessness. That's how you stop all of this altogether. I put a lot of money into the budget that would increase mental health services. I think it's just shameful what we have done in the last 30 years where we have ignored this problem. I've supported putting more money for mental health and drug addiction for years. And I'm glad for Chief Ballard who brought this to light, that this is an important issue, but that kind of got put aside at the state legislature because of the crisis. And so I'm hoping it gets back to focus again, because we are really going to have a very big problem if we cannot financially improve the situation of a lot of our residents very soon.
So yeah, sorry, I thought Tom was going to explain more about what we just started to do with regards to the post program and whatnot. So we're actually going to get involved with the post program. We're going to use Our Lady of KL as the location to where we're going to be able to have our homeless population come there so they can go ahead and get screened for the virus and whatnot. But Our Lady of KL is going to be the location right now because of the pandemic that's going on. We just had a meeting with Marina, who is representing St. Francis Hospital, who actually is running Our Lady of KL right now. And on Wednesday, Tom McDonald was able to put together a meeting with the CEO of St. Francis. So at 2 p.m., we're going to meet at Our Lady of KL to hammer out everything that needs to be done. So we already got support from Chief Ballard, Captain Lambert, who is heading the post program. He's already been notified of what's going on at Our Lady of KL. We're going to have 24-hour security there, 24/7, and everything is moving in the direction that we need to go. And it's my understanding that Tom McDonald had already applied to get part of that ESG grant. So hopefully within the next 2 weeks, we can get everything up and running so we can do more to help our RCPs down on the west side. So I apologize for not going over that with you earlier when I spoke, but I assumed Tom was going to be here, but I guess he had an emergency. So, but that's one of the biggest things that we're doing for our homeless situation down on the west side. So hopefully we can get that thing up and running and we can help those people.
Mahalo.
Yeah.
Move on to my wonderful neighbor, Mr. Reeve. You had a question?
I did. Aloha. A warm aloha to Micah and Sergeant Kahikina. Really just, appreciate all the work that you guys are continuing to do. Sergeant Kahikina, the first question I had is, how many people is this new setup, this new supposed to hold? And I'm going to get to my other question and then I'll let you respond. And I want to make a quick statement because I think that the elected officials that are still here completely missed the surgeon's point. And that is that the responsible people that live on the west side in the community, we understand the seriousness of what's going on, and none of us want to infect our friends or our family. But me not being able to get a haircut has nothing to do with tourism and has everything to do with employing people out here on the west side specifically. And those are businesses that we can't patronage right now because of, frankly, these ridiculous rules. And I can't see any reason why I can't be responsible and go get a haircut and go to and visit some of the local restaurants. And I don't think anybody out here wants to see 10 million tourists in this state again. It's the strain on the INA and the oceans is, frankly, it's too much. But we have got to get back to work. None of the elected officials here have taken a 75 or 80% cut in their pay. So it's frustrating when you tell us that you understand how we are dealing with this, and yet none of you are dealing with this like we are. So we just have got to get back to work. So I guess that's it. I'll let Sergeant Kahikina respond. So thank you for your time.
Mahalo.
So what we're trying to do is the initial is to help 50 of our RCPs. That's the initial goal. And then once we go ahead and take care of that initial 50, then we can try and progress for more of them to come out to Our Lady of Keal. The issue that we're going to run into is the ones that want the help with regards to that don't want the help. The ones that don't want the help is the ones that are just going to be defiant. They want to go on living about their life as a homeless person. So those are the ones that we're going to have to focus on so that we can still enforce our park closure laws and have these individuals respect the law with regards to the park closures. But the initial, with regards to the question, is actually going to be 50. And then we're going to go from there. I think I'm right on that, right, Cedric?
Yeah, so about 40 people, yeah, is what we've been discussing. And this is all pretty preliminary. We still have to, again, get confirmation from St. Francis and so forth. But we do have service providers out here who are taking the initiative, who are willing to really step in where they're needed and to help provide that coordination all the way around until they are housed in some type of permanent housing situation. So that's a really positive outcome out of these discussions and out of Sergeant Kahikina's frustration with doing these enforcements without having any real solution to address them moving from one area to another. So I'm hoping that with this, we'll have some type of stick and carrot where, if you want services, there's services available. And if you don't want services and you want to disobey the law, then there's also HPD for that. I think with that combination, we should get some type of cooperation with these individuals that have been hard on getting into these services. So I'm hoping that with this and with the continued discussion that we're having with our service providers, that we will be able to produce something that will have that impact. So I'm excited about that. And then to Mr. Reeves' question about, trying to open back up our economy, I totally agree. I think we do need to open back up our economy, and we are awaiting our executive branch. From the legislators' side of it, we really don't have any oversight on what the governor does. We're writing him, we're calling him, we're doing a lot of the same things that we're asking our constituents to do to make sure that our voices are heard at the very top, because these are the people who are going to be making the decisions whether we open up or not. With the positive outlook that has been given in the recent press conference from the governor, it looks like our economy could be one of the first economies in the nation to open back up and try to recover from this COVID-19 pandemic. Again, though, we still have to move cautiously. We have to make sure that we're protecting our community and making sure that, everything, all the resources that we're going to need to make a strong comeback will be in place for that. So I think there is a lot of debate and there's a lot of conversations going on within government, within my caucus, the majority caucus, and I'm sure in Senator Shimabukuro's caucus and Councilwoman Pine, we're all looking at ways that we can add to the conversation and also represent our constituency in regards to reopening up the economy and getting people back to work. So thank you for that. Okay, we're gonna move on to a next question. I see Philip Ganaban, he has his hand up. Go ahead.
Okay, so hey, first of all, I want to say thank you guys. This has been really informative and really good. So thank you guys again for that. My concern with bringing up the economy back up again is that many of the shortcuts that's going to be taken to get things going, to get the economic moving. You know, I get it. You know, it's like we need to get people employed and stuff. But my concern about that is development. Yeah. So I'm wanting to make sure that at least get my voice in there, is that we're not going to use this opportunity because people are, you know, in financial need, that we're going to allow developers to come in and say, okay, you know what, we'll be the saviors, and so let us develop the area at a cost, you know what I mean, that will not benefit the community. You know, so I totally in for self-help style programs on this side, because they keep the spacing at a good distance. But I just want to make sure that we're not, you know, going to be shortcutting, and permits are not just going to be waived because we're trying to get jobs moving, especially on our side of the island.
Mahalo. And I think that's a great question for Councilwoman Pine, given her role in the city council, as well as oversight on the city Department of Permitting and Planning and Permitting. If you could give some insight on what that looks like, how does the community, you know, address these developments that may be coming up because of we're trying to start up the construction industry or whatnot, and maybe how they may be able to provide input to the discussion as well, given that no neighborhood boards are active and so forth.
Okay, no, thank you for that question. I have to tell you that when we talk about using construction industry to save our economy, in no way does it allow any fast tracking of new developments and new zone changes that will change like ag land to you know, building homes. That's just not going to happen. How we can do this the smart way is, first, no one is advocating here, any of the elected officials, saying, let's just open the economy. What we're advocating for is recognizing that people are suffering and working harder and faster to find a solution to get people back to work by using science, using the medical information that we have, and social distancing and new ideas to get us back to work. What I advocate for when I say we need to fast track the permitting process, that is to change this ancient style of permitting where it's taking grandma and grandpa next door to take a year just to get a permit for a fence that's 6 feet high. That is how bad things are in the Department of Planning and Permitting right now. And so nowhere we're talking about the zone changes that creep up on you. What we're talking about, just basic remodels. If you wanna remodel a bathroom, it shouldn't take a year. In other cities and states, it could take 2 weeks to get approvals, as long as you have your licensed architect and engineer. And what they do is they put all of their money into in-person inspections, because anyone can lie on an application. And we're spending 1 year to 2 years looking at applications when we should be sending real people into these projects, making sure that their application and what they wrote that they've said they're going to do matches what's happening in person. If we could do that, we could add an extra $1 billion to our economy within a year. If we just make simple changes that other cities are already doing, but also allow the community input to protest anything that they disagree with. Okay.
Mahalo. Thank you, Councilwoman Pine. We got any other questions from the community? Go ahead and just unmute your mic and ask the question.
We have enough time for 2 more questions.
2 more questions. Any questions? Any of our presentators want to provide any additional information that you weren't able to provide in that short period of time?
And then Cedric, I got a few questions too late on that have been texted to me or emailed.
Yeah, okay. Got it. So I'm gonna go ahead and ask again one more time. Any other questions before we end this town hall and make some closing remarks?
Yes, aloha. I have one quick question.
Go ahead, Didi.
Thank you guys for hosting this thing for us. It's very informative, very helpful. Just a quick question is, I was just curious, did we get any positive test results from the testing at the boat harbor in our community?
I can answer that.
Go ahead, Councilman.
That's just something that we can't answer, just because you know, some people were seen getting tested, and I don't want anyone to assume that they were the ones that are positive or negative. But I can tell you, since I first put a call out for Waianae residents to get tested, that our numbers did double. However, we still are the lowest on the entire Leeward Coast. I'm extremely proud of Waianae residents for doing such a great job of social distancing. And we just need to continue to do that. And what I feel grateful for is that we are getting these results in the early stages of people's positive tests. The deaths that we have had were because people didn't go to the doctor soon enough. So I want to continue to encourage people to go get tested. If you have any symptoms, you don't have to have it all at once now. They're being more lenient. And then if anyone refuses to give you a test, call me and I will find a doctor or clinic that will get you tested.
Thank you.
Thank you. And I see one last question from John Doe, and then we'll have closing remarks. Go ahead, Jonathan. I keep calling you John Doe because that's the name that's on the screen. Sorry about that.
And but since I have the time,
It's John Doe. It's John Doe, Cedric.
yeah. So, I guess kind of the kill, you know, getting back to that sweep, if we can make sure there's a plan for any barricades. I know they can move them, but people, they eventually might be moved, but just to slow down any, you know, people moving back in. And also, just a real quick, you know, the Honolulu 311 app, you know, I report stuff, and then I know like we got to keep, you know, on top of it, what is state and what is city. But then, you know, when I put a report in, they say, oh, contact DHHL because that's their land. And then I contact DHHL and leave a message, talk to a secretary, and they say they'll relay the message to call me back, and I haven't heard them for 3 days, and I got to call them back. But so I don't know if how we can clarify, or just maybe in that app, maybe it's not the right place to say it, but in that app to, if any improvements to, if we report something that the city or whatever can relay, or, you know, that report, they can send it to the proper authority having jurisdiction. I guess that's one thing, because there's some heavy dumping going up on Kolea Li'ili'i, I think. Is there a homestead up there off of Waianae Valley Road? Kolea Li'ili'i Street. So that's the one I was trying to get in touch with, or the association there. So.
And Councilwoman Pine, you may be able to answer that 311 or pass that along. But also, John, you know, you're always welcome to reach out to any of your representatives here and ask us to follow up on those kind of things, and we'll be glad to do that. So just know that we're accessible, and we can follow up on those kind of things as well.
Okay, thank you. Thanks for
Kim,
your guys'
you had
time.
anything to add to that?
I always recommend people to go to the 311 app first, just because sometimes you can track their response. That's the only reason why I like people to go there. But if you get confusing responses and you don't get the response that you need, if it's an urgent matter, definitely work with the elected officials and all our staff on the Waianae Coast. We are very close with each other, and we try to resolve some of the issues. There are some complicated land areas on the Waianae Coast where some of us aren't even sure who owns the land, and sometimes it will take the elected official to say, okay, you just do it. The cities will just take care of it, or the state will just take care of it. So that's how we'll try to handle that situation for you.
Okay. All right. With that, I'll provide some closing remarks along with any of the other presenters if you want to. But I want to first again thank all of you folks who have been, you know, practicing social distancing and taking other measures to allow the state of Hawaii to be the second lowest state in the nation with COVID positive population. And also, you know, we are, as your elected officials, continuing to work to address your concerns. And we also have our staff still teleworking. So you can always, again, reach out to us and we'll put out that contact information. I try to do that as much as possible because we really want to hear from the community. You are our eyes and ears throughout the community. We can't be everywhere. And, you know, during session, we're crammed up in our offices, doing the people's work and trying to pass bills and get funding for our community. But now that we're out, you know, we're trying to be as involved as we can in our community affairs in any way possible. So if you guys also have any information that you guys want to pass along to us that could use some cool, you know, that's always welcome for our office, and I'm sure from the rest of the elected officials here. This is just one of a few town halls that we are planning, virtual town halls, to provide community with accurate, up-to-date information. We had some great presenters today. I want to thank all of them for participating and giving their time to provide updates to the community on the great work they're doing throughout the Waianae Coast. And if we haven't got you an answer that you asked today, again, follow up with us and we can provide that at a later date. And again, we'll have some additional town halls and we'll have some additional guests to provide a broader overview of what's happening on our coastline and throughout the state of Hawaii. And that will be my closing remarks. Mahalo, everyone. You guys have a great night.
Thank you. So I just quick as my closing. It's okay. I just want to give a quick tip out there that if any of you are still waiting for your stimulus check from the federal government, and I know for some people the holdup is if you don't have direct deposit information you gave to the IRS, there's a free app called Cash App you can put on your phone. It's kind of like Venmo, and through Cash App you can actually provide direct deposit information to the IRS. They have a special website on Cash App, and so I have a friend that did that, and so it's a quicker way to get your check, because if you wait for them to mail it to you, it's going to take a lot longer. So again, it's called Cash App, and it's a free thing you can put on your phone, and it's a good way to get your stimulus check if you don't have a direct deposit. Okay.
Awesome. That's a great update.
Mahalo.
Thanks.
Yeah, mahalo. I look forward to having another town hall. We can cover a lot more topics, and thanks to everyone for participating tonight. It's been wonderful.
Councilwoman Pine,
I just
go
want to
ahead.
say a few words. I wanted to thank all of you folks for inviting all of us together. There's one place in my district that I just know that they are going to do the best in all of Hawaii and get through this together and overcome hardship together, and that's the Waianae Coast. You are the most resilient community that I have ever known in my whole time as an elected official. I believe in you, and I know that we will find a way to create a resilient city. We will no longer be a victim to other people investing in us for us to survive. We come from immigrant communities that had nothing and came here. We have a Native Hawaiian population that thrived on its own. So this is our opportunity to dream big. And we will use this time to think about the changes that we want to see for the future. And I am so excited that we have this opportunity. As painful as this whole experience has been, it is a time for a rebirth for all of us. So thank you, everyone. We love all of you. We appreciate your time tonight, and we look forward to the next time. Ahuiho.
Okay. Ahuiho, everyone. You guys take care. Have a great night. Aloha.
Bye.